Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And my topic today is mental illness and disability. Now, Social Security considers physical problems for disability, also mental problems, and many people have both. But I'm going to focus on mental health issues and disability today. And as usual, everything I say represents my own opinions based on my own experience and learning, and not the opinions of the Social Security Administration or any other medical body. And as I said in my most recent video, I'm going to tell you Social Security's rules, and some of them may make some people unhappy. I don't run Social Security. I don't run the government. If I did, I might do things somewhat differently. But I have to follow Social Security's rules. So if you're unhappy with them, I suggest you can contact your representative and senators, and don't get mad at me. Now first, I'd like to talk a little bit about the different types of mental illness. And first of all, what is mental illness? Mental illness to me is a problem with thinking, behavior, and emotions that is persistent and that is maladaptive, that makes life more difficult for the person. I group mental health disorders into 6 large groups. The first are the neuroses. People with neuroses are in touch with reality, and they feel bad, usually either feeling depressed or anxious. In the neurosis, the patient thinks there's something wrong with them and thinks that everybody else is doing just fine. The psychoses are mental illnesses where the patient is out of touch with reality. They may have hallucinations, such as hearing voices when nobody's really there, or seeing things that aren't real. Or they may have delusions, which are false beliefs, such as a patient I had last year who told me that when he would take a new job, within a few weeks he would become convinced that his co-workers were plotting to kill him. The third class are the personality disorders. In the personality disorders, the patient's behavior causes problems with others, but the patient feels they're just fine. There's nothing wrong with them. The problem is with everyone else. Personality disorders tend to come on the earliest of all mental illnesses, usually in early childhood. Both the neuroses and psychoses tend to come on in late adolescence or early adulthood. The next group of mental health disorders are the addictions, which are pretty much self-evident. I define as an addiction as a harmful behavior that the patient continues despite harm and is unable to stop. I use a somewhat antiquated term for the fifth group. These are the organic brain syndromes. This is where something is wrong with the patient's brain that causes problems with their thinking, memory, and or personality. And there are many causes. A person can be born with a brain problem. Most cases of mental retardation are an example. They can have a head injury that can injure the brain. They can have an infection like meningitis that can infect the brain and damage it. They can have a ruptured blood vessel bleeding into the brain, causing brain damage, and many other causes. But unlike the neuroses, psychoses, and personality disorders, there is a clear physical brain problem causing the patient's abnormal thought processes and behavior. And then the final group I call miscellaneous. These are a group of divergent disorders such as eating disorders, anorexia and bulimia, autism, disorders with tics such as Tourette's syndrome, and a whole bunch of other less common disorders. Keep in mind that a person may have more than one disorder. For example, a person may have depression and they may start drinking to help their depression, and they may develop an alcoholism problem that coexists with their depression problem. However, something I see all the time, in my opinion, reflects the terrible state of mental health care in the United States today, which is patients with collections of 4, 5, 6, or even more psychiatric diagnoses. I believe there are many patients with one condition, a fair number of patients with 2, a few with 3, but any more than 3, they probably have an incompetent therapist. Another thing that I see all the time is patients who tell me they have bipolar disorder and depression. The old name for bipolar disorder was manic depression, and to be diagnosed with bipolar disorder, you must have episodes of mania and episodes of depression. Therefore, it's impossible to have bipolar disorder and depression, because the depression is part of the bipolar disorder. Again, if you've been given those 2 separate diagnoses, you probably have an incompetent therapist. Another thing many people are not aware of is that there are fads in psychiatric diagnoses. The diagnoses come and go based on the whims of the time. The current 4 fad diagnoses, which I think are way too overdiagnosed, are attention deficit hyperactivity disorder, post-traumatic stress disorder, narcissistic personality disorder, and bipolar disorder. Here's an interesting fact. Most people who undergo a very difficult, trying circumstance grow. They become psychologically stronger. Instead of having post-traumatic stress disorder, they have a condition called post-traumatic growth disorder. I heard an excellent example of this in a radio broadcast where they interviewed a female Army physician. She had been on a helicopter evacuation with seriously wounded soldiers in Iraq, and her helicopter had been shot down and she'd been taken prisoner, where she suffered repeated episodes of rape and torture. The interviewer said, well, you certainly must have post-traumatic stress disorder from that. And she said, no, it made me stronger. Here are some other conditions which are not mental illnesses. Number 1, laziness. I recently heard an example of a person who wanted to apply for Social Security disability because they were lazy. Laziness is not a mental health disorder. Neither is having a temper. Neither is being moody unless the moods are persistent and extreme, as in bipolar disorder. Forgetting things from time to time is not a mental health disorder. For example, forgetting a word and having it on the tip of your tongue before it comes back to you in a minute or 2 is called lethalogica and is normal. Another example is change of frame forgetfulness, where you walk into a room to get something, and the minute you walk into the room, you've forgotten what you wanted to get because your frame has changed. That also is normal. Another very important thing to understand is psychological evaluations. The physician who does a consultative examination is not tasked with doing a psychological evaluation. I tell the patient that I'm there to evaluate their physical problems. If they have serious mental health problems, that needs to be treated separately. However, if I see obvious signs of serious mental illness, I'll put that down in my record. For example, if the patient is obviously hearing voices and tells me they're hearing voices and what the voices are saying to them, I'll put that in my record. Social Security hires independent clinical psychologists to do psychological evaluations. Just as a consultative examination, physician meets with the patient, takes a medical history, and does a physical examination and prepares a report, the Social Security psychological evaluators meet with the patient, take a mental health history, often do some mental health tests, and prepare a report. If you're seeing a therapist, a psychiatrist, psychologist, social worker, etc., and you're seeing them regularly and you've seen them recently and you've gotten your records to Social Security, that probably isn't necessary. But if you don't have recent mental health records, it's important to get a psychological evaluation if mental illness is a big part of your disability. And I often explain that to patients and often make a recommendation for a psychological evaluation if the people tell me that their mental health issues are a big part of their disability claim. Now, the same with physical problems. If you're going to get disability solely for mental health problems, they have to be pretty severe. As I say, unfortunately, whatever is bad for the patient is good for their disability claim. Social Security defines work-related mental health abilities as 4 groups. The first is the ability to understand, remember, and apply information. The second is the ability to interact with others. The third is the ability to concentrate, persist, and maintain pace. And the fourth is the ability to adapt and manage oneself, to regulate one's emotions, control behavior, and maintain well-being in a work setting. To get disability approved based solely on a mental health problem, there has to be severe limitation of one of those 4 groups or marked limitation of 2 or more of those 4 groups. And Social Security divides limitations into 5 degrees of severity. As with every cause of disability, mental health concerns are in Social Security's listing of impairments under listing 12-00, and I'll put a link to the listing in the description of this video. The listing of impairments is the Bible of disability, and I strongly urge you to study it. To meet a listing, the psychological condition must have been present for at least 2 years. Unlike physical conditions, Social Security will accept information from a broad group of people. You can have your family, friends, clergy, neighbors, case manager, social worker, or shelter staff contribute information as long as Social Security has your permission to gather that information. This can be very helpful for some people. For example, a lot of people with serious mental illness have episodes of homelessness and don't have continuous medical care. In that example, you could get the homeless shelter workers to write a letter to Social Security demonstrating that you'd had mental health problems and for how long. Community outreach workers and school vocational trainers can also contribute information about mental health problems. Now, here's another important Social Security rule to understand. If a person's problems are due to an addiction to alcohol or drugs, and if the person's addiction is continuing, they're continuing to drink or to take drugs, and if the condition would improve if they stopped, Social Security will not approve a disability claim. If they've stopped and the condition persists, then they will approve the claim. And if the condition would persist despite them stopping, they may approve the claim. An example could be someone who's gotten infected with HIV from injecting fentanyl and now has AIDS. Even if they stopped using fentanyl, they'd still have AIDS and would qualify for disability. However, I saw a patient last month who had alcoholism and cirrhosis of the liver and liver failure from drinking and was continuing to drink. Cirrhosis of the liver is a serious and disabling condition. However, it does improve if the person stops drinking. How much it improves is impossible to predict. It could be a mild improvement, a moderate improvement, or a marked improvement. But as long as this patient persists in drinking, Social Security will not approve a disability claim. Interestingly, there are two addictions where Social Security will approve disability. Those are addictions to tobacco. You can continue to smoke 2 packs a day and get Social Security for your severe lung disease, and addiction to food. Although Social Security used to approve disability for severe obesity, but no longer will. Again, I have mixed feelings about that. I had a patient who died of obesity at age 28. He weighed over 600 pounds and his heart just couldn't support that weight, and he died of heart failure. He ate himself to death. Finally, I'm going to talk about my brief 4-question screening for severe mental illness. I often ask these questions to get a baseline idea of how bad the patient's mental illness is. Number 1, have they ever been admitted to a psychiatric facility? And if so, how many times? I had a woman in her early 40s with manic depression who'd been admitted over 20 times to a psychiatric facility. It would be pretty hard to work if every 6 months you're going in the psych ward. Number 2, has the person ever attempted suicide? Number 3, have they ever been addicted to drugs or alcohol? And number 4, have they ever been arrested? And here I'm looking at the sort of arrests that people with mental illness tend to get, such as drunk and disorderly or public nuisance, not things like burglary or auto theft. One of the sad things about serious mental illness in the United States is that the seriously mental ill are often put in jail or prison rather than in a mental hospital or psychiatric ward where they could get the help they really need. Well, I hope this has been useful, and as always, remember, if it happens, it's possible.